a challenge to dignity. Our goal was to link academics, activists, and agencies concerned with the health of refugees and asylum seekers in a spirit of collaboration and comparison, bringing together professionals working with different populations of forcibly displaced peoples, ethnic groups, and nations. The video you are watching will contain an individual presentation edited to stand alone. We hope you find them to be of value. So our next paper is by our own group here at UC San Diego Global Health Institute. I'm one of the authors, Tom Csordas. I'm a professor of anthropology here at UC San Diego and director of the Global Health Program in the Global Health Institute. My co-authors are Brenda Wilson, who is a postdoctoral scholar in the Global Health Institute and a lecturer in the Global Health Program, and Alexis Burnstan, who is the program coordinator for Global Health Institute and for the Tracing Asylum Seekers Trajectories Project. And our title is An Ethnography of Care, Physicians and Asylum Seekers on the US-Mexico Border. This, what you see in front of you now, is the team, the research team for Tracing Asylum Seekers Experience and Trajectory, which we have funding for from the UC San Diego Academic Senate and the binational Proyecto de Investigación en Migración y Salud. Brenda and I will be sharing this presentation, and so I'll take the first 10 minutes and she'll take the second 10 minutes. Our project began at the end of 2018 with the wave of caravan that were coming to the southern border at the time. And we were provoked into starting our research by that series of events. And to be precise, we were provoked into it in large part by the image that you see in front of us, which we found to be incredibly disturbing and provocative. And we began from that point to engage in what we call an ethnography of care, with the goals of which are to document the evolving networks of healthcare for refugees and asylum seekers, and to describe the lived experience of both healthcare providers and asylum seekers. Since March of 2020, we've also been concerned with how this situation has been exacerbated by the coronavirus pandemic. We're going to focus primarily on the part of our work that we've done with the healthcare providers because they need to be paid attention to, and not only the experience of the asylum seekers. Our study so far has interviewed 43 people in the US-Mexico border area who work for a variety of healthcare provision and service provision organizations and agencies that you see listed here in front of you. One of the biggest issues that we have faced right from the beginning in looking at people volunteering in the face of the crisis of refugee and then the crisis within the crisis, the coronavirus pandemic, is the challenge of preparedness for healthcare providers in a humanitarian setting. And the fact that regardless of how well-trained one is, it's not always the case that a person is or can be completely prepared for what encounters. We're going to draw first from the master's thesis of Tiana McMahon, one of our research team members, which focuses on the distinction between institutional and clinical preparedness. The challenges of institutional preparedness begin with unpredictable increases and decreases in the number of refugees, as well as changes in immigration policies, difficulty in securing adequate staffing, barriers to care in the medical bureaucracy, and lack of adequate communication and communicative channels. The challenges of clinical preparedness include unfamiliarity with rare infectious diseases, complications from pre-existing conditions,
mental health effects of trauma and torture of multiple kinds that may be layered one upon the other, sexual and reproductive health of women who flee while pregnant, language barriers when asylum seekers may be arriving from multiple countries, and on the other hand, over specialization of clinical volunteers. These two quotes that you see on the slide are, you can barely read those. Maybe we need to put the shades down back there. Is it, you can see them okay? Okay, so one of the physicians was saying, the previous 15 years I've been working primarily as a clinical and metabolic doc, which puts you in a very specialized place. I did primary care for my patients that had rare diseases, and I was briefly comfortable seeing both kids and adults in that context, but had not really worked as a straight pediatrician for a number of years. It was anxiety provoking at the beginning, whether or not I would be able to make it work, whether I still have the skills and ability to do it. And another said, what am I underprepared for? A lot of times stuff comes up, which is like what you think of as a simple question or routine problem, but because I'm not boarded in family practice, I wouldn't know the answer. Every time I go to the shelter, I have to look again at certain protocols because I would be completely lost without the protocol, even if it is something really simple, like what's the antibiotic for otitis media? Like, I don't know that. I'm not a family practice. I don't treat otitis. I have to look it up every time. Simple stuff like that I would be underprepared for. My point here is quite simply paying attention to the experience, the frustrations, the lived experience of our healthcare providers is an important element of what we have to understand in dealing with refugee and asylum seeker health and well-being. These were interviews that were done before the pandemic struck. Once the pandemic struck, things, of course, got even more complex. And we found that this is the case dealing with migrant clinics at the port of entry and in detention centers. Now, I'm going to say just a couple of things about the first two, about migrant clinics and at the port of entry. One of the places that we have worked most closely with is our own UC San Diego healthcare clinic for screening asylum seekers and refugees at the Jewish Family Services Migrant Family Shelter. And one of the first things that we got in our interviews from the first year of the pandemic was the coming into the clinic of people who were from China. And the doctor who we interviewed is saying, and laughing incredulously, yes, that was total racism. They were Chinese. They had not been in Wuhan. They hadn't even been in China for over a month. But Border Patrol sent them in N95 masks and scrubs and all their belongings in a garbage bag. It kind of just raised red flags, but then we spoke to them. They had already been screened for COVID and quarantined. They were totally asymptomatic, so we just realized that, laughing again and rolling her eyes. This was just purely because they had Chinese passports, but they had actually spent like over a month in Mexico before they were detained. And then they were quarantined for 14 days. So they were like, definitely didn't have COVID. And it was when we had just a few cases here in San Diego and everyone was just getting very anxious. So here you have the immediacy of the lived experience of the healthcare provider confronted with an instance of explicit racism in dealing with a group of Chinese immigrants who couldn't possibly have had coronavirus. From the same clinic, a year later, we have a comment like this from a physician. Like everybody across the world, we've all been affected by the concern of infection and the steps we've had to take to keep ourselves from getting infected. So, massive social disruption to our lives with creating pause or worse, isolation, being separated from family members. I just saw my sister for the first time in 2 years. If we've been fortunate enough to not get COVID and not have either long hauler syndrome or death, then we've had to consider how to take care of ourselves in this new world. Professionally, my group and my colleagues had a massive disruption in the way our lives went. It's just massively increased the workload in addition to our regular jobs and that workload. Our research was disrupted. I think everybody's been worked very hard, no question. I mean, I probably work 60 to 80 hours a week. moving to another setting, physicians who are actually encountering refugees and asylum seekers for the first time as they come across into the port of entry. In the first year of the pandemic, we had the physicians saying, as a physician in leadership, when you're interacting with Customs and Border Protection, you do have to maintain some form of relationship with them or everything's lost. And again, we have a laugh. Those telling chuckles are very telling. And as a physician and a human being, you don't want to turn a blind eye to what your colleagues or advocacy groups, to any of the big tent of ideas and say, no, we can't do that. I get the sense that the Border Patrol loves Title 42, the legal authority they're operating under currently because of the public health emergency. It makes their job that much easier. People get tossed back to Mexico quickly. We don't have all these pesky pregnant women and kids seeking asylum. You know, that's kind of the cynical way I said it. But my observation is that Title 42 is the dream of this, the Trump administration, when it comes to immigration for asylum seekers and similar groups of people. And again, you have that coming right in the first wave of the pandemic when physicians are trying to deal with and cope with relations with government officials in the immigration sector. A year later, we have a comment from the same group, physicians saying, the thing I see most commonly is the minor injury, but still maybe a significant enough injury that would require an operation or something else. And they'll say, we're not going to do it. We're not taking them. They're going back to Mexico. You know, they're on the list to go back this evening or whatever. So we saw that early on, and they're probably still doing it. The same with COVID. We'd identify an individual we were concerned about having COVID. You know, the answer would be, no, we're not taking them to the hospital to get tested. We'll Title 42 them and send them back to Mexico. So we would have someone sick, potentially with COVID, being sent back to Mexico to go to the doctor there. I mean, knowing full well that most of these folks really don't have access to help. In general, there is still no COVID testing at these frontline facilities, whether it's a port of entry or a border patrol station. So here we have examples from two places here on the border dealing with asylum seekers. Two different places in 2 different years of the pandemic. They are describing concrete situations that they're dealing with. But I ask you to look behind those concrete situations and see the implicit frustration, the implicit stress, the implicit emotional consequences that these situations have for the physicians themselves. And these are physicians who are deeply committed, and physicians who sometimes are more than committed, who actually lay their bodies on the lines for the sake of refugees. This photograph of a physician protest was taken in December 2019, just before the onset of the pandemic. And it was a protest at the conditions for asylees who were in detention centers. And this is in the wake of a flu outbreak that was going through detention centers. So again, point is, let's pay attention to our healthcare providers along with the experience of the asylum seekers. And this is a theme that Brenda will take farther. And I think that Dr. Murphy will take even farther when we have her presentation.
Thank you. Welcome, everybody. It's lovely to see everyone here. And so now, as Tom said, I'm going to kind of turn our shift a little bit more to look at what other various states along the border with between U.S. and Mexico are faring in relation to providing care for asylum seekers during what we're calling this crisis within a crisis. So one way that we are doing this is by participating as a member of the U.S.-Mexico Border Alliance Group, which has been spearheaded by Save the Children, which is an international NGO. So the Border Alliance Group was really initiated in November 2020, essentially in the lead up to the U.S. presidential election and in the lead up to potential shifts in policies And so at that time, there were many border communities who were already convening to strategize for all different potential outcomes following the election. But there was a need for a centralized group to really drive resources. And this was something being highlighted by all of these different various border communities. And so the Border Alliance then was created to fill that gap. And Save the Children then essentially became this umbrella organization to help facilitate all of this. So in addition to our tacit team, So in addition to our tacit team from UCSD, there are a vast number of other participating members and organizations that are part of this Border Alliance group. And so this list is not an exhaustive list, but it does give you a general idea of the breadth of expertise that is sitting on these calls. They are once a month calls. And again, representing organizations internationally and domestically, and representing all of the 4 border states between California to Texas. And so these range, for example, from federal and state and local government agencies to cities and county officials, numbers of universities aside from UCSD. There's a number of international and US-based humanitarian organizations like the American Red Cross and others, as well as many volunteer groups that are sort of on the ground at the border, bringing basic necessities to the asylum seekers that are waiting, especially on the Mexican side of the border. And there is even the participation of a corporate entity. Greyhound Bus Lines was recently added on to these Border Alliance calls, especially for their role in transporting asylum seekers from the shelters to their destinations where their sponsors live. So, and what we are seeing and hearing from these monthly Border Alliance calls is how each state, and even within states, various regions are at times dealing with varied and diverse different kinds of challenges in relation to meeting the care needs of asylum seekers. And so we are going to present 3 different kind of emergent themes that really reflect this kind of state of flux, which is feeling the uncertainty, not only amongst care providers, but also asylum seekers themselves in ways that ultimately affect well-being. And so these 3 themes that we will be discussing today are this sort of like this idea of policy environment always in flux, looking at the migrant protection protocols and Title 42 in particular. The second theme is then COVID testing and vaccination, always in flux. And that has somewhat to do with many factors, but one of those is the role of the state in relation to funding. And then the third and final theme would be nationalities of asylum seekers at entry, and then the communication phenomenon. So the first theme then is this idea about the policy environment always seemingly being in flux. And so Title 42, for example, and many of you will be familiar with this, but for those who are not, Title 42 was essentially invoked by the Trump administration under the claim that migrants might be bringing in COVID-19. And so this Title 42 was invoked, and it dramatically restricted immigration, ultimately blocking asylum seekers from their legal right to apply for asylum at ports of entry. The Biden administration has so far kept this in place, despite the pleas by immigration advocacies to lift it, and despite the fact that we now have widespread availabilities of COVID testing and vaccination. Title 42 has, up till the latest figures, prevented around 600,000 people from seeking asylum in the United States. Just since September the 19th alone, looking at the Haitian population, approximately 7,400 Haitian refugees were expelled under Title 42. Essentially, this is problematic for a number of reasons, but these expulsions are occurring at breakneck speeds, suggesting misuse and abuse of Title 42. And then the second policy, the migrant protection protocols, this was also invoked under the Trump administration and enacted in January of 2019. And this required asylum seekers to wait in Mexico for the entirety of their legal cases, which can take several years. During this policy, approximately 60,000 were sent back to Mexico to wait between January and October of 2019, and this resulted in these kinds of makeshift tent encampments alongside the Mexican border, where asylum seekers were made to wait. And then after Biden took office, the MPP was ended, but then there are rumors about it partially being reinstated again, and now it's being held up in courts. And so all of this kind of policy environment is creating confusion. It's creating a lot of frustration amongst asylum seekers and their care providers as well. So based on care provider interviews, we know that asylum seekers have strong medical and health needs. Without clear information about what's going to happen with the MPP and for how much longer Title 42 will be in place, this uncertainty may increase asylum seekers' desperation and their suffering. So, for example, the Hope Border Institute has found that Title 42 expulsions are creating confusion and, in fact, driving more dangerous crossings across the Rio Grande and other dangerous crossings across the border. And then the threat of possible reinstatement of MPP, along with the prolonged Title 42 expulsions, has frustrated families and shelters in Mexico, increasing a sense of overall helplessness. And that was a quote out of the Save the Children at the Border Alliance calls. So, and another, sort of like aspect of this is that although our interviews with care providers are certainly important to understanding the different kinds of challenges that asylum seekers are facing, it's really important for us to listen firsthand to the lived experiences of asylum seekers themselves to really fully understand the magnitude of how these policies always in flux are impacting their health and well-being. And so the second theme then is about COVID testing and vaccination of asylum seekers is always sort of manifesting in various different states in terms of availability. Shelter by shelter seems to be very different. Recent developments have seen some states faring better than others, and this can be seen especially when we're looking at California compared to Texas. So California has been able to grow in capacity, especially with the state's recent commitment to $28 million. The state of California is in sharp contrast in comparison to some of the other border states that have emerged essentially against Biden's immigration policies. Texas, in comparison, does not have that same level of commitment at the state level for asylum seeker care. So in March 2021, Greg Abbott turned down federal assistance from the Biden administration for COVID testing while simultaneously blaming immigrants for bringing in COVID infections. And this, of course, leaves cities and individual shelters to their own means to find ways for funding testing. And then the third and final theme is this sort of overall uncertainty about the numbers of people that are coming in at any given time, the nationalities, the flows. So at present, mostly Title 42 exempt nationalities are being received across states and shelters. These include populations of Venezuelans, Cubans, Brazilians, Haitians, and others. The immigration agencies like CBP are giving little to no advance notice to many of these shelters about what time or how many or the numbers of asylum seekers that are coming in. And this kind of further burdens this volunteer shortage of being able to really, provide the kind of care needed at any given particular time. And so this kind of phenomenon is really captured by one of the quotes from a clinician based in San Diego, who said that with the semi-reinstatement of the MPP and ongoing use of Title 42 to essentially return anyone, we'll have waves and we never really know who will receive it at any particular moment. At one point, pregnant women from Haiti were coming in, but now we're not sure. I don't know why that is beyond this bigger notion that there is this fairly predictable variability in who happens to be here at any given time on policy. And so I think that really captures this idea of the frustrations about all of these changes in flux that are taking place.
Linda, can you explain the Title 42 nationality exemptions? Who's exempted and why?
Yeah, and so there's a lot of confusion around that as well. And so essentially, Title 42 has been legally, if it's being applied as it's supposed to be directed at Mexicans and Central Americans being returned back into Mexico. But what we're hearing on these border alliance calls is that that's not necessarily being enacted, and all kinds of people are being sent back to Mexico that are not supposed to be. Haitians, for example, there are flights of Haitians returning back to Haiti, but this is kind of like feeling this whole overall idea of this general uncertainty about what's going on. So yes. So and even people on the border alliance calls are very baffled by this, like exactly what's going on and how this policy is being enacted. And so it's just in conclusion, a couple of concluding remarks. So although networks of care have demonstrated remarkable resiliency amidst a state of uncertainty, it certainly poses difficulties for care providers nonetheless, in order to fully meet the needs of asylum seekers. This constant flux of policies creates this sort of overall sense of uncertainty, increasing the desperation and decreasing overall well-being of asylum seekers. And so these kinds of fractured and disjointed efforts across the state are really an indicator of failures at the federal level. So our flawed asylum system and the lack of political will to fulfill its international mandates and own domestic laws is certainly something that needs to be taken more seriously. On that note, the U.S. asylum system can be thought about as a racialized structure of violence. And so anytime that these politicians like Greg Abbott or even like the wider public that is perpetuating this myth of the disease-ridden immigrant are essentially perpetuating a more than 100-year-old racialized trope that continues to inform immigration policy, which bears on the need for us to move past this for a historically informed approach to understanding disease and immigration that does not resort to racialized stereotypes and scapegoating of immigrants. And ultimately, whenever we're thinking about policies, it becomes essentially very important to think about the effects of these policies and the violent spaces that they are creating. One of those violent spaces was certainly those refugee tent encampments that came out of the Trump migrant protection protocol. And so these tent encampments not only made more vulnerable asylum seekers to COVID infection in these tent encampments, but also to gang violence. So kidnappings and beatings became very commonplace. These are just images of the camp along the Matamoros, Mexico. And so in thinking about these creations of violent spaces, I'm reminded of Mbembe's concept of necropolitics, which he has described as these forms of social existence in which vast populations are subjected to conditions of life that confer upon them the status of living dead. And so on that note, I would just reiterate what Tom was saying at the end of his talk, that we need to have sustained advocacy by care providers for promoting healthy policies. Thank you.
We have a few minutes for questions, if there are any, before our break.
I have a question, and because I've been curious about what happened with the Haitians in Del Rio. So like with the MPP, we had, like a couple years worth of time to basically organize groups outside of the government in order to provide medical care or relief to the people living in those encampments on the other side of the border. But when we had that group of Haitians come, and then the US was so swift in getting rid of them, it wasn't clear to me that anything had been organized apart from the governmental effort, which I will speak briefly to, that was organized by the CMO of DHS. Do you happen to know if there was anything that was happening with other groups? And then also, the thing that I heard that I haven't been able to corroborate is that those people were mostly Haitians, but that there were a number of other Black migrants in that group. And I heard that they had all been deported to Haiti, regardless of their nationalities. But I don't know if you know more.
Yeah, so there are Haitians, just to answer the first part of the question, there are Haitians at other ports of entry other than that Del Rio, but Del Rio certainly has seen like the largest numbers of Haitians. And, to the second part, there on the Border Alliance calls, particularly with the El Paso sector and other Texas groups, there's this sort of noticeable anti-Blackness enactment of the policies. And this is very problematic. And as you said, there is some conflating of Haitians with Cameroonians and other African populations. But it kind of ties back to my comment or answer with Seth, is that this Title 42 is being used to invoke whoever, whatever, whenever, to whatever countries, regardless of how it's supposed to be, actually enacted. And all of this is just, it's very frustrating for asylum seekers, to say the very, very least. Nobody knows. In fact, even the transportation, some of the calls, the shelters will talk about how Haitians, but also other populations as well, are being put onto some of these buses and then trotted off to another city without even knowing where they're going. And then once they're at that destination, then they might sit in holding for a while and then ultimately be flown, and still not knowing where they're going. And so, this is like sort of this theme, right, that's coming out about like these things are always in flux. It's always, it's creates a bunch of fear, it creates a bunch of confusion, and just ultimately just impacts everybody's, overall well-being. Yes.
We have one question that's coming in from one of our other participants, and then we're gonna actually have to go to break. This is from Kristen Yaris from the University of Oregon, and she's saying it's interesting to consider physicians as political actors in the U.S. In other countries, doctors and health professionals are often on the front lines contesting political and economic policies, but we see this type of overt political action less often in the U.S. Perhaps a reflection of structural differences, like a lack of national healthcare system in the U.S. and privatization of U.S. medicine. At the same time, U.S. physicians have a lot of moral authority culturally, suggesting that if they are to take a lead as political actors, that would have a large impact socially. Just wondering your thoughts on health professionals as political actors demanding policy changes. We all think of physicians as very overworked, and becoming political actors and activists is an additional demand. This is why we're bringing attention and admiration to those physicians who do take on that additional role. And I won't say anything beyond that, because I think this is an issue that's going to be directly addressed by our next presenter right after the break.